Here is your question. Right, so if you have read and understood, considering it communication skills session, kindly begin.
Yes, ma'am. Ma'am, should we start?
Yes, begin please.
Okay. Hello, I'm Dr. Sanola Khan, and one of the doctors in the department for treating you. And can I ask your name, please?
Yes, I am David. I am 65 years old.
Okay. Hello, David. I was told that you are having some concerns regarding your stopping of warfarin. Can you tell me about your apprehension toward this medication?
Yes, doctor. I had this mechanical heart valve replacement 30 years ago, and my doctors told me not to stop this medication warfarin ever again. But one of your doctors told me to stop this medication before the surgery. But how would I live without that medication, doctor? I don't want to stop it.
Okay, Mr. David, first let me explain a bit about this medication and what is this for. Warfarin is actually a medication used for blood thinning, and especially for those people who are having some mechanical heart problems, just to prevent clotting inside the blood. As you are on the list for surgery, and we'll be operating your hernia, and we must need to stop this because of risk of bleeding. And but meanwhile, we will not be leaving you like that. We will be prescribing some other medication which is called heparin, which we'll be using it in this for time. The main problem with warfarin is that it's having a long half life, and we will have to stop for 5 days before the surgery. And the other drug which I'm telling you about the heparin, and that is you can stop for 12 hours before surgery.
Okay, so why my previous doctor didn't give me the heparin drug? Then you don't have to stop the warfarin, right?
Yes, I can understand your concerns, but the main thing about the other drug is that we'll be injecting it inside your vessels, and the warfarin is oral medication, so one can take really easily in home. One can but cannot inject the other medication whole life.
Okay. So when can I resume my previous warfarin drug?
Yes, just after the surgery, if we when we came to know that there is no risk of further bleeding, so we will start your warfarin, and meanwhile we will also be giving the heparin as well. After we came to know with some investigation that now your warfarin is doing its work, so then we'll after that we will stop the other medication.
Okay. Is it necessary to stay in the hospital prior to operation?
Yes, it's not necessary for hernia surgery, but for people like you who are having risk for blood clotting and having the mechanical heart surgery, so we will keep them in the hospital for some days to start the warfarin with checking its effect with some investigation.
Doctor, why you said people like me? What is wrong with people like me?
Because you are having surgery for mechanical heart, and also you are using warfarin. If we let you go to home, then it will not be possible to check the effect of warfarin there. So that's why we are keeping you here, and also to rule out risk of bleeding, and also not to let you go home with some risk of blood clots in your body.
But I don't want to stay in your hospital.
Yeah, we'll let you go after after completing the course of Warfarin, starting a course of Warfarin, and after that
No,
you can
I
go home.
don't stay in the hospital before the operation. I want to come in your hospital in the morning of the operation.
But doing this will not be possible for us because we want to start the heparin after stopping the warfarin because you are at risk of blood clotting inside your body.
Okay, let me clear one thing. People like me, as I'm a blind person, I have everything measured in my house. Okay, so I cannot leave my house.
Okay, so I can understand your answer. We will arrange social worker for that, and they will help you out in this condition.
Okay, is it
Do you have
necessary
any
to
other
stop
question?
my anti-anxiety medication before the operation?
For now, you can take your anxiety medication in the morning with a sip of water, not more than that, because you will not be allowed to drink or eat more water. So you will take it just with a sip of water.
Okay.
Do you have any further question about this?
No.
Okay, so Mr. David, you came here for hernia surgery, and you are having problem of mechanical heart valve surgery, for which you are taking warfarin as well. For now, I told you and explained the effect of warfarin, and also make you understand about the why it needs to be stopped before surgery. If you are having any further question, I'm here. You can ask me. Thank you so much.
You're welcome.
You still have 2 minutes and 30 seconds left.
Yeah, ma'am, I think we did completely because we don't have any further question.
Did you explain why heparin should be given?
Actually, man, he didn't ask me about this.
Yeah, but you can tell now because you still have 2 minutes.
Okay. So what should I tell him?
Why heparin should be given?
Ma'am, I asked him.
Okay.
I asked him,
The importance of heparin.
Yeah, actually, ma'am, I told him that it's necessary because it will prevent the clotting of blood inside the body, and if, we can
Give.
stop it 12 hours
Yes.
before surgery.
Yes.
And what else I can tell?
Duration of action.
Yeah, duration
12
because
hours
it's
and
only
5 days.
12 hours, and I tell him about the warfarin 5 days, and also we can stop the heparin for 12 hours before surgery.
Yes. When would it be stopped after surgery? When would I take warfarin again?
Yeah, just as I mentioned that when we came to know that there is no risk of further bleeding, and you can start after 6 hours warfarin, and also meanwhile we will be giving you heparin as well. After we came to know that your warfarin has started work, then we'll stop heparin.
Doctor, when I was taking warfarin, my doctor used to take a blood test to check my INR. How would you carry out that procedure when I'll be on heparin?
Yeah, yes, we will do a PTINR test to check if warfarin has started work, and your INR is in the range of not getting blood clots inside your body. Then we will stop heparin after that.
Would that affect the value of my INR if I'll be taking heparin?
No, it will not be affecting. Yes, if you will be taking both of them, then it will affect. But after that, I don't think you can take. It will affect your result.
What should be the normal one? Normal range of INR when I'm taking heparin?
Yeah, for a person like you, it should be about 1.5 to 2, and normally it is about 1.
Thank you.
Thank you. You're welcome.